What do the statistics tell us about suicide? That's the question that I'm going to answer today in this video. First, if you're struggling with any mental health issues or struggling with thoughts related to self-harm, please call this number right here, 988. That's 988. So jumping straight into the statistics behind suicide. So suicide is the 10th leading cause of death in the United States. And that's based on data from the Centers for Disease Control and Prevention, or the CDC. And then when you look at different age groups, especially those age groups between 10 to late 30s, you'll see that it's actually one of the leading causes, even higher in specific age groups. And there's an overall estimate that there's one suicide every 11 minutes. So just really think about that. One suicide every 11 minutes in a given year. That's a really painful number to think about, really. Considering these numbers behind it, suicide and self-harm is still something that's widely considered taboo or stigmatized. It's something that often folks feel like they can't discuss. And because of that, a lot of people who may be experiencing these severe suicidal thoughts may not necessarily disclose it to other people. Some other statistics that I want to present related to suicide are having severe suicidal thoughts or serious suicidal thoughts, making a suicide plan, and carrying out a suicidal attempt. Now, again, I'm going to display this number right here in this video, 988. So if anyone is experiencing any self-harm related thoughts or know someone who may be experiencing some self-harm related thoughts, please refer them to this number right here. Jumping into the statistics behind serious suicidal thoughts, that's about 1 in 20 people. So 5% or 1 in 20 people had a serious suicidal thought in the United States in the past year. Now, when it comes to making a suicide plan, about 5 million people in the United States made some sort of suicide plan in the past year. Then jumping straight into the statistics regarding making a suicide attempt. So about 2.3 million people in the United States made some sort of suicide attempt in the past year. Just to reiterate these numbers, about 1 in 20 people had some sort of serious suicide thought in the past year. 5 million people in the United States had some sort of suicide plan in the past year. And about 2.3 million people in the United States made some sort of suicide attempt. And another sobering number to think about is that 1 in 5 people who made a non-fatal suicide attempt go on to continue to try to make at least some sort of other suicide attempt. We must ask ourselves, what are some preventive measures that we can put in place to help people so that they don't feel as though they have to take that last resort? And we also have to ask ourselves, what are some barriers that may be in place that may halt some people from actually seeking help or actually talking to someone or seeking some sort of assistance? Some of these common reasons that I've heard are, suicide is something that's stigmatized both externally and internally. Someone may feel as though if they talk to other people related to suicide, that they may be judged, they may be criticized, they may be ostracized. And then even internally, they may feel ashamed and feel self-stigma for having these thoughts. Some people may fear the consequences of disclosing this sort of information. Some people may feel as though therapy or, talking to someone may not necessarily work for them, or receiving medications for treatment may not necessarily work for them. Some people may have this idea that they don't want to be a burden to others by bringing this up, that they're experiencing these intense emotional and mental stressors. There may be some cultural, religious, or familial thoughts and belief systems that the person may feel they're violating if they mention that they're experiencing these thoughts. And we must ask ourselves on a societal level, do we as a people know what to do? As an overall society, do we know what to do? Do most people know what to do if someone comes to them and says, hey, I'm experiencing these thoughts and I'm thinking about wanting to harm myself? Do most people know what to do? And if most people don't know what to do, what can we do to increase this knowledge so that people know of amazing resources like this number right here, 988? What can we do to reduce the stigma related to suicide so that if someone is experiencing these thoughts, they will at least be willing to talk to someone or at least seek out some services, seek out some help? In the same way that we know the emergency number of 911, what can we do to make sure that the number 988 is as well known as this number 911? How do we go about raising awareness? Ultimately, it takes all of us to put our minds together to find out ways to improve the mental health services that are out there for people, or increase the knowledge about the availability of these services that are out there and increase access, and then trying to reduce the stigma and judgment regarding self-harm and suicide. Because ultimately, even if it doesn't impact you, it could impact someone that's close to you and near to you. Now, overall, I just threw some numbers and questions out there. I know that there are some brilliant brains out there that can figure this out, and there may be even some looking at this video. So thank you a million for watching this, and I hope that some of this information can help someone out there. Thank you.